When you're ready to attach your needle, your tubing and your soft set needle, you want to attach the needle. You want to hit the prime button. Which is the purge on the lower left-hand side. Make sure your tubing is unlocked. Press the purge button, hold it down until you see the liquid come through the end of the needle. Once that is complete and you have medication flowing through the end of your soft set, you want to prep your area on the patient's abdomen, whatever area you decide to use the sub-Q needle, and then at that point you can take off the safety guard, the tape. You can use the stylus, this blue pen, insert into the patient's tissue and make sure to remove the pen once you have inserted it. At that point you can secure it with your Tegaderm and your tape to the skin.